All right, so hello everyone. Thank you all for coming. We are the VetRx team, and we created a drug cost estimation tool for veterans. So before we get into the details of what we've done, I'd like to introduce our team really quick if they would like to unmute.
Hi, I'm Josh.
I'm Catherine.
I'm Hannah.
I'm Brandon.
And I'm Danny.
And our project, I'm not sure if many of you know, but 30% of veterans with diabetes have both Medicare Part D health insurance and Veterans Affairs coverage. So this means that 1.2 million veterans have to navigate between these two very complex systems, and this can be very challenging and frustrating for many of them. And so we were tasked with creating a web application that simplifies the process of navigating between these two systems to acquire the most affordable diabetes medications for veterans. And now Brandon will give us a little background.
Thanks, Catherine. So our first couple of days were spent understanding insurance. We learned that there are many different factors that can affect the price of drugs. This simple flowchart shows the most important factors in price calculation. Each one of these makes a big contribution to the final price calculation of an individual drug. So for Medicare Part D, as you can see, the provider plan and pharmacy are really important. And for VA, we use the drug exemption and the exemption status and then the different drugs. And then we compare these two prices to see which one's cheaper. Naturally, with researching insurance, we ran into a lot of data. However, the drug price data that we needed is not publicly available, which resulted in us utilizing synthetic data. Now I'll hand it over to Josh to talk about development.
Thank you, Brandon. After spending the first couple weeks of the project grasping a basic understanding of how all this seemingly random data were related and how the process of insurance coverage worked, we were eager to start developing and coding hands-on. So we decided on our tech stack and we took to Figma to create the initial designs for our website and began to develop a prototype of our application. So in terms of the tech stack, we are using a Ruby on Rails backend because of the support Duke OIT is able to provide, given its extensive use among Duke OIT teams. And we decided on using Postgres for a database management system because of its flexibility and its ability to manage our very large data files, and the Next.js front end because it enables a feature-rich design with plenty of libraries and documentation to pull from to incorporate into our project. In terms of our first prototype, we created a version 1 of our website, which contained a multi-page design and a homepage that explained the purpose of our tool, some facts about why the tool is useful, and buttons to navigate to different parts of the website. The survey page, which is listed in the middle, contains the main functionality of the website, which was a questionnaire that allowed you to input the minimum amount of information with the least amount of invasivity and press a calculate now button to see your results, which at this point in the project was using simulated data that was randomly generated. And you'd be able to see which plan had cheaper coverage for each drug. And it would allow users to pick the best options for each drug based on their plans. And we had a lot of feedback and iterative development for this, and we heard from our Microsoft sponsors and our stakeholders. There was a lot of clicking and scrolling involved with this multi-page design, so we moved on to a version 2, which we'll demo later on in the presentation. In terms of accessibility, throughout the development of the product, we kept accessibility as one of our highest priorities because a tool is only useful if it's accessible to its target audience. And for us, that target audience is veterans. So accommodating for disabilities is especially important for our project. And in addition to this, our Microsoft sponsors informed us that developing with accessibility in mind is much more efficient than reworking the product after it's hit production. So it's something that we kept at the forefront of our minds while developing. And 1 out of 10 men are colorblind, and other various vision-related disabilities could inhibit the use of this tool if we didn't include features like alternative text, navigability using HTML tags, and tabbing throughout the website for mouse-free functionality. Now I'll hand it off to Danny to talk about a process of reworking the database in order to improve the functionality of the website.
Thanks, Josh. Our database and website have gone through many substantial changes. As Josh mentioned, until very recently, we were using a database we created that was realistic and based on how real drug prices are calculated, but one that ultimately used entirely simulated data. We did this because it was unclear if and how the Medicare files we initially explored could give accurate drug prices, and we wanted to make progress in at least creating a proof of concept of our project. However, 2 weeks ago, our primary stakeholder urged us to revisit official Medicare spreadsheets, and after looking at them again, we had a breakthrough. What you see here is a highly simplified diagram showing how Medicare prices can be calculated. By taking information about the user's health plan, the pharmacies they fill their prescription at, and the prescriptions themselves, we could use these inputs to navigate 7 large Medicare spreadsheets and identify 3 key variables that go into price. First, drug coverage amount, which is if and to what extent an insurance provider is willing to help pay for a medication. Second, preferred status, meaning whether the pharmacies the user goes to are preferred under that health plan. And finally, unit cost, which is the base cost of the drug. All these variables play a role in calculating the actual out-of-pocket costs for users, which are a fraction of the unit cost. After getting to this new understanding, we restructured our database to match these spreadsheets, and then it was time for us to put the Medicare data into our data tables. But in the process, we crashed the Code Plus database. It was most likely the 40 gigabyte pharmacy file, which had all the unique combinations of every single health plan and pharmacy in the US. But in the end, we were able to fix that issue and filter for only North Carolina plans and whittle our database down to only about 200 megabytes. After cutting down all our spreadsheets, we coded new methods that made calculating Medicare prices or giving close estimates when data was missing possible. Now I'll hand it off to Catherine to talk about calculating Veterans Affairs prices.
Thank you, Danny. So as you can see with this chart, the Veterans Affairs price calculation side is a lot more straightforward than Medicare. So from the user, we have input and indicate whether they have Veterans Affairs exemptions. This would mean that all of their medicine is completely covered for, and so the displayed price for whatever medication they input would always be 0, and then they put in them in medications that they're interested in. Now, for those who do not have exemptions, each medication is assigned a specific drug tier, and each drug tier has a specific set price. So we would find the drug tiers for the medications that they have put in through our tables, and then we would display the price on the front end, and this would also include any information that may impact their ability to procure the medication. For example, if they have to try a lower price medication before they are able to try this higher price medication they are interested in. It is also worth noting that we did not have any data files for the VA side, so we manually added data to the database tables based on VA government websites and information. And now I will hand it off to Brandon to discuss pharmacies.
Thank you, Catherine. So for pharmacies, it was one of the most important components of our website, as it's meant to show you the cheapest and closest pharmacies. So in our website, we take in the user's zip code and display the closest pharmacies using the Google Maps API. We then take this list and use the NPBES API to find the individual pharmacy number linked to that specific pharmacy. And we take the pharmacy number and the Medicare plan to look through the database to determine if a pharmacy is preferred or not. Then we return a list to the front end of all the preferred pharmacies, and then we highlight them in a yellow color, and then we also add a P icon to show the user that that pharmacy is preferred and it would be cheaper for them to use. Now I'll hand it over to Hannah for a demonstration.
Thank you, Brandon. So as Josh mentioned, we did go through a lot of iteration and many different changes from our version 1 to our version 2. One notably is that we went from a multi-page website to a single page site where you can view both the survey and the results at the same time. So I'm going to go ahead and start the demo. Hopefully this will work. Okay, so as you scroll down to our website, you can see at the bottom is a calculate price estimate button. If you click it, it gives you the information you need to plug in. And if you go back up, and for example, if I just try to enter quantity, it tells me what I need to fill in before. So I'll fill in medication, strength, quantity, and days applied. We also added a feature where you can add medications because many people with diabetes actually require many different medications to alleviate different ailments. And we also added a feature where if you change your mind and decide you don't want a medication, you can also just remove the medication in total. So after you fill out certain drop downs, you can also go down and see what else you need to fill in again. And I need the provider plan for pharmacies. So if I try to enter in my zip code and try to see my preferred pharmacy, it doesn't let me unless I put in a provider and a plan. As Danny mentioned, these all go into the final cost. So we do need to figure out each individual thing. If I want to figure out my coverage phrase, I don't know what that is. We have several info buttons that explain different terms. In this case, I'm choosing initial coverage phase if I completed my deductible. Extra help is something from Medicare that allows you to receive some extra help in terms of co-payment, and exemptions completely exempts you from any co-payments that you might have to pay for. So if you plug in your provider and plan, you can search for your pharmacies, and it's going to take a little bit to load here because it does go to it does need to go back to the API, as Brandon mentioned earlier. And you can see here, you can select 2 different pharmacies, choosing CVS and Walgreens because those are the most common. And the P icon is also hoverable to see what preferred pharmacy actually means to the client or user. So in this case, the plan that I chose has an alert that shows that the plan's formulary is not in the Medicare data files, which means it'll show estimated price only. And automatically, these result cards will choose the cheapest price and give you a total. And these totals are changeable based on which pharmacy, or if you want to choose VA, these are all changeable and also show like how much it will cost per year as well. You can see on the left, there's also icons. As Catherine mentioned, there's different like prior authorization, step therapy that is needed. And if you click on these icons, it'll lead you to a legend that'll explain these in further detail. So it should just provide the most information to our users. An alert sign will show if the exact cost is not there and an estimated price is returned. So the functionality of single page website allows us to change any details that we want to. For example, I would like to change my plan because we don't have the data for it, and we can just change it and select anything different from the previous questions. And if you resubmit your provider and plan, you can see if there are other preferred pharmacies with that plan. After some loading, you can see that Walgreens and CVS, Walgreens is now preferred because of a different plan. And if you go down and press calculate price estimate again, you can see that it automatically selects the cheapest price. And because I selected yes for extra help, all Medicare prices are now $4.15. But you can also just select different items and totals just to see what different combinations would get you. If you ever have any trouble knowing how to interpret a result card, there's a need help button or link that will lead you to this site that'll explain every single thing in detail in case it is a little bit confusing to understand. And if you scroll all the way down, you can see, check the FAQ page for more answers. And for example, if I want to know what exemptions would I have, I can just click on that question and I can just see what exemptions would qualify me. And if I click the About Us page, About tab, it'll show basically just a brief overview of our entire project. This could just be useful for anything that we want to add in for extra information on the current like project that we have in hand. We have a little our mission statement and a cute About Us of our team, which is really nice to see. And that's the basic functionality of our website. All of these buttons will lead back to where you need to go. So for example, if you want to go back to the survey page, you can press the big compare now button or to anything in the nav bar. Okay, so I'm going to go to the next slide really quickly. So our future plans, basically right now, our website is currently limited to just diabetes medication and only 6 specific majorly used ones and North Carolina. We plan to, if possible, we plan to expand the scope past diabetes medications because people with veterans with diabetes also may need medications for different ailments. And we also want to expand just past North Carolina. We also got OAuth working on our site, but unfortunately we couldn't go through the steps to fully utilize in that website, but we would like to use what we got from OAuth to pre-fill medications for veterans, which would make it easier for them. And Dr. Anna Hung, our primary stakeholder, plans to use our website as a proof of concept in order for future funding and also implement this tool on our website and make it public. And we would like to also create accounts that will store user information. So we like to acknowledge a lot of people that helped us on our project. Obviously, if I go through this entire slide, it may take some time, but our stakeholders, our Microsoft sponsors, our team leads, and our project facilitators all gave us a lot of good advice throughout the entire project, which allowed us to essentially create this website.